Let's bring you an update on Health Today. The Federal Executive Council meeting, it held in the Presidential Villa, Abuja. The federal government has stepped down consideration and deliberation on the memo on the new minimum wage to hold wide consultation before a bill is sent to the National Assembly. That's the message from the Minister of Information and National Orientation, Mohammed Idris, at a briefing to State House correspondents on the decisions taken at the council meeting. He said President Bola Tinubu has studied the report submitted by the Tripartite Committee on Minimum Wage and would consult further before a final submission on a new national minimum wage to the National Assembly. And away from that, let's bring you updates on the outbreak of cholera in Nigeria and efforts to curb further spread. The Nigeria Center for Disease Control and Prevention has placed the country at high risk after conducting an assessment in response to the increasing cases. So far, 1,528 suspected cases and 53 deaths have been recorded across 31 states and 107 local government areas, and it's with a case fatality rate of 3.5% since the beginning of the year.
As of the 24th of June 2024, a total number of 1,528 suspected cases and 53 deaths have been recorded across 31 states, 107 local governments, with a case fatality rate of 3.5% since the beginning of the year. 3.5% is the average now, and the national expected average is just 1%. So we find these fatalities as not just statistics, but a significant loss of loved family members, spouses, and parents, and often a seasoned healthcare worker and team member. This situation is likely to be compounded as the rainy season intensifies. If you or anyone you know experience sudden watery diarrhea, please do not self-medicate. Visit a healthcare facility immediately. To our health workers, we urge them to always practice standard safety precautions, which include wearing gloves while handling patients or providing care to an ill patient or relative, and intensify surveillance efforts to promptly report suspected cholera cases to the various health departments.
In Oyo State, the Seyi Makinde-led government has announced that it has identified 7 suspected cases in the state. Commissioner for Health, Oluwaserimi Ajetumobi, addressed journalists in Ibadan, the Oyo State capital.
Nigeria is currently experiencing cholera outbreak, with the Nigeria Center for Disease Control and Prevention reporting over 1,528 suspected cases in 31 states. The main cause of the outbreak has been linked to contaminated water and poor sanitation, made worse by the rainy season, which can spread the disease through flooding and unsafe water sources. Following this development, Oyo State government says it has identified some suspected cases and they are under observation. The ministry also adds that it has implemented measures to contain the outbreak and prevent further spread.
So far, so good. God has blessed us in Oyo State. I told you before that before now, we have started preparing for this kind of emergency preparedness. And so far, so good. We have 7 suspected cases in Oyo State as at this morning. And out of these 7 suspected cases, 5 had been declared negative. We are awaiting the culture of 2 other suspects. As I'm talking to you, we don't have any positive case of cholera.
Regarding the ongoing strike by the health workers in Oyo State, the commissioner assured that Governor Makinde is actively working to address the workers' demands and resolve the issue.
But it's just to tell you that before now, even before they declared their strike, the governor, the executive governor of Oyo State, Engineer Seyi Makinde, has tried his possible best to make sure that he puts might on the faces of workers. The salary is not being denied, but it's just that they want an increase. And part of this increase, everything has to be on deck because, just as you know now, the nurses are on strike too. And they are coming on strike. They cannot do for a part and neglect the other. Everything has to be taken together so that, because if you do for a part and neglect the other, it's a vicious cycle. Other two will come and they say they are going on strike then. So he's trying his possible effort to make sure that everybody is happy.
The Oyo State government's move to contain the cholera outbreak and end the health workers' strike in the state is a major move towards ensuring that normalcy is maintained in the state health sector. Olaide Oyewole, TVC News, Ibadan.